Good morning. Can you guys all hear me? Can you hear me?
Yes, we can hear you.
Wonderful. Well, thank you for having me. I'm going to give this presentation and I'm going to have to do it very quickly because I have another appointment. But I want to thank you for having me here. I want to congratulate you on this event. I want to acknowledge all the women who are living with breast cancer, who've been diagnosed with breast cancer. It's important for you to know you're not alone. It's a very common disease. 1 in 8 women will be diagnosed with breast cancer. So I think it's important to understand that it's not the end, even if it is metastatic. Early breast cancer is curable. Metastatic disease is treatable. And it's still, possible to have a good quality of life while living or being diagnosed with breast cancer. So I've been asked to give a talk on nutrition and breast cancer as it pertains to how to eat, what lifestyle is important to prevent breast cancer while being treated for breast cancer and in the survivorship phase, which is at the end of a breast cancer treatment. So I'll just spend the next few minutes talking about those changes for prevention in the survivorship phase. And the first question is, why is it even important to talk about diet and even lifestyle when you've been diagnosed with breast cancer? I think it's important to know what risk factors are. Risk doesn't necessarily mean that it's a direct cause. It means that it increases your risk of this particular cancer. We're talking about breast cancer today. There are certain risk factors that we can't change. Getting older is part of life. Aging increases your risk of all cancers, but obviously breast cancer, we can't change that. Being female, men do get breast cancer as well, but it's a higher incidence in women. You can't change your genetics. It's what you've inherited, what you're born with, so you can't change that. Obviously, exposure to radiation, sometimes that is something you can control. But we're going to focus on the 2 things that we have the ability to control and how that is tied to our diet. So that would be obesity as well as alcohol. We have very good data showing that both things increase the risk of breast cancer. And how does obesity lead to cancer? So not only does obesity increase the risk of breast cancer, it increases the risk of other types of cancers too. Colon cancer, esophageal cancer. Once again, we're focusing on breast cancer today. The reason why obesity contributes to an increased risk of breast cancer is with fat cells, which is associated with being obese. Fat cells release estrogen in the body, right? So after menopause, estrogen is made by fat cells, and these can multiply in the breast. We do know that the hormone receptor positive type of breast cancer is the most common type. So the fat being converted to estrogen increases the risk of breast cancer. Fat cells also increase inflammation in the body, which can increase the risk of cancer. And excess fat in the body also increases insulin and growth factors in the body, which can actually tell the cells to divide more rapidly. And as cells are dividing more rapidly, mistakes can happen, and those mistakes can lead to cancer. So I'll focus a little bit on alcohol. We know alcohol can increase the risk of breast cancer because alcohol itself directly raises the level of estrogen in the body. It can cause damage to cell DNA. It can actually reduce our body's ability to absorb nutrients that are important for our body's ability to function, such as folate. It can increase the risk of cancer because it can increase stress, what we call oxidative stress in the body, and that impairs the body's ability to eliminate harmful chemicals in the body. So consuming alcohol not only has this direct effects in terms of estrogen and stress levels in the body, but it also is empty calories, as we call it. So those calories increase your ability to make more fat and increases your obesity. And obesity, as I've talked about earlier, increases the risk of breast cancer. This is a very nice graph that actually shows the importance of calories and weight control in the development of breast cancer. This was a decades-long study. It was the Women's Health Initiative, where they had thousands of women, and they compared women who were eating healthy and who were able to maintain a healthy weight. And these were women who hadn't developed cancer, breast cancer. So they looked at one group of women who had good, healthy eating habits, were maintaining a healthy weight, and then they compared them to women who were not necessarily being prudent about the kind of diet they were eating. So there was no dietary modification in that group. And when you look at this graph, you look at the red and the blue, and you could see that the patients who had the low-fat intervention group, that's in the blue, had a lower risk of cancer development. So we have very good data that ties how we eat, healthy eating, healthy weight, to risk of breast cancer. So it's just showing the scientific part of it. So the kind of more practical questions that patients want to know, it's nice to have all the studies and all of that, but the practicality is usually what patients are asking, well, what do I eat and how do I eat? And I think it's important for us when we're talking to different groups of people. I live here in the US. I'm in Brooklyn, New York right now. It's very, very cold. So I'm jealous that you guys are in the heat. But we have a pretty diverse group of patients from different parts of the world. And there's always this desire to tell people what to eat, how to eat, but it's important to also understand food is very important to people. It's very important in terms of your cultural identity, what you enjoy. So generally the recommendation is telling patients and encouraging patients to eat more whole foods as we're becoming more global and have access to the kind of foods that's being eaten in the West. We find that a lot of people are doing more processed foods, more fast foods, which are generally not healthy. So it's finding the healthy ingredients to make the kind of foods that feel good to you, that feels like home to you. You don't have to eat what we eat here in the US or in other parts of the world, but knowing that whole grains, vegetables, whole fruits, nuts, seeds, plant oils, those are things that are healthy, and those are the ingredients that you should be using for your meals. We know that there's an increase in cancer association with red meat. It's not to eat meat, but kind of reducing the amount of red meat. You can go more the fish route, the more chicken, poultry route, and reducing the amount of red meat that you eat. Drinking water, we talked about the importance of reducing your alcohol intake, but limiting things that calories, right? So sugar, sweetened beverages, the sodas, the juices, recommend against that. Refined grains and sweets, if you're going to do bread and white rice, which my family is Nigerian, so I understand, how important our rice and our on refined grains to make those things that we enjoy. Maybe consider brown rice instead of white rice. Or when you do the white rice in smaller quantities, baking stuff rather than frying stuff. I talked about the need to eat less red meat, definitely less processed meat. We have data showing that with red meat, there are certain breakdown products of red meat that increases the inflammatory state of the body, which can increase the risk of cancer. We talked about avoiding alcohol. For patients who choose to drink, there's, everything in moderation, but the guidelines really suggest no more than 1 drink per day for women and no more than 2 drinks per day for male. And it's just that we process and break down alcohol differently in terms of men and women based on the amount of water that we have in our body. So women not to have more than 1 drink per day. And then moving on to exercise. Exercise and physical activity is absolutely important as cancer prevention and actually while being treated with cancer. For cancer, whether that's with chemotherapy, radiation, anti-hormone treatments. Obviously, there are side effects that makes it more difficult for patients to engage in physical activity when they're being treated, when they're on chemotherapy. Fatigue is a very common side effect of chemotherapy and many of the treatments associated with the cancer diagnosis. But for patients who have the physical ability to, we actually do encourage physical activity during treatment. We have studies that actually show that improves the patient's outcomes. So, moderate activity, whether it's walking, biking, and then vigorous activity just to stay in good health. And for patients who are overweight, who we encourage to lose weight, we recommend an hour of moderate to vigorous activity. Vigorous activity during treatment, not so much, but as prevention and in the survivorship phase, absolutely. There is a strong link between physical activity and decreased risk of breast cancer. So we encourage that strongly. Part of our conversation in the survivorship phase is really just encouraging patients to become physical. And like I mentioned, exercising with cancer, while being treated, it's safe if you're able to do it. Listen to your body, but if you're able to do physical activity, definitely recommend that. Stretching, aerobic exercises, start slowly and then work your way up. I think a lot of times there's fear, and even your loved ones around you are like, oh, take it easy, rest, don't do this, I'll do this for you, which is lovely because they care. But if you have the physical ability to do these things during treatment, we strongly recommend it. And then finally, about bone health, this is very important. For our patients who have hormone receptor positive breast cancer, we give anti-estrogen treatments, sometimes, for 5 years, sometimes longer. For patients who are metastatic, they will need to be on some form of anti-hormone treatment long-term. We know that estrogen is actually good for the bones, but not for cancer. So when we give this anti-estrogen medications, we're reducing the body's ability to make estrogen, which then increases the risk of bone loss and osteoporosis and bone fracture. So this is just a picture I put on here to show what normal bone looks like. And as the estrogen therapy is being given, it can develop to osteopenia, osteoporosis, and in some cases fracture. So the question is, what do you do to offset that risk that is associated with bone loss while on anti-estrogen treatment? We recommend foods that are high in calcium, so dairy products, milk, cheese. Vitamin D is good for the bones, protein, fruits and vegetables, and exercising is actually good for the bone. Weight-bearing exercises, so exercises working against gravity actually helps to build bones. What is happening is as you're exercising, there's signals that are being sent to the bones, telling the bones to make more what we call osteoblasts, which are the cells that prompt the bones to build more bone tissue. So exercising is also very important at all phases. So just in quick summary, in terms of the dietary and lifestyle practices, they are important, but in all honesty, it's really similar in the breast cancer prevention realm during breast cancer treatment, as well as in the survivorship phase. There are patients while they're getting chemotherapy and they'll come to me, food doesn't taste good. It tastes a little bit metallic. They've developed this inability to enjoy food because chemotherapy has really robbed them of that taste and kind of destroyed their taste buds a little bit. And so I tell patients, find what is healthy, find what you can tolerate. And if you have to do that throughout the treatment, that's fine. Those symptoms will resolve and go away once chemotherapy is done. But the gist of this short talk is that this dietary and lifestyle practices are really not different depending on what stage you are in, whether it's prevention, treatment, or post-cancer diagnosis. And this is the end of my talk. Thank you.
Thank you very much, Doctora. We appreciate you for the lucid presentation. I need to go to the gym after hearing all of this. I need to resume gym activities. Thank you so much. I appreciate you.